All right. So this is just an introductory meeting, just to talk about the summer immersion program at RWJ. I'm sure you guys have heard about it, maybe through Dr. Cott or through just OSIC in general. But this is just a general overview meeting to talk about the application process, what you'd be doing at the immersion program if you get accepted, and what to look forward to for that. So our anticipated dates for it are June 17th to June 28th. So it'll be like the last 2 weeks of June. That's what it was last year, but our schedule is a little bit different than the M1s last year since the M1s ended. I think their semester ended like mid-June, so this is right after semester ended. So we're currently working to see what dates would work best for the residents because we want to have it ideally before the interns come in. So you could block off those 2 weeks for now, but it might change. We will confirm before the applications are due what the actual dates are. So be on the lookout for that. And these are just some general pictures from last year. Okay, so today's agenda, we'll go over some introductions, some program overview, feedback, yada yada. So the faculty advisors of the program are Dr. Cott, Dr. McPartland, and Dr. Gatt. Um, Our chief resident, Jomar, is going to be the resident lead for the year. So a lot of you, if you go into the program, you'll see Jomar a lot. This program was founded a few years ago by Jilica, who's now, I think, in M3. And she was a big part in having this program get started. So it's only in its third or fourth year since it starts. So it's fairly new, but we're trying to make it bigger and having other schools also apply to this program as well. Anirudh was the senior advisor for it last year, and he'll also be a big part of helping out this year, and I'll be the OSIC lead for this year. Okay, so the purpose of the program is to provide incoming second year medical students interested in orthopedics with an invaluable summer experience. So basically, it's just to have you kind of live the life of a resident, like an orthopedic resident for a week to just see what the day-to-day is like because I'm sure a lot of people are very interested in ortho, but it's very different in terms of actually living the resident lifestyle and going about their day-to-day routine. So I think it'll be a really good introduction to seeing how their day goes about, whether you're in the operating room or in clinic or in journal club. There'll be a lot of great things you could be a part of in this program. You'll also have the opportunity to develop relationships with residents and attending mentors. I think you'll really enhance your orthopedic knowledge throughout the program. And yeah. So here were the two groups last year. So it's a 2 week program. So each week there's about four people or five that were selected to be a part of the program. And so expectations in the program, uh, professionalism is huge. I think they really want you to practice being like a resident, being like an actual doctor. So wearing a white coat on all non-operative days, wearing scrubs when you're in the OR, knowing how to sort of act in the OR, having OR etiquette, business casual, student engagement, rounding on patients with residents, shadowing in the clinic, in private offices, in the OR, attending in-person Zoom lectures. So a big part of the program is just building your professional expertise, sort of in medicine, understanding how to act around attendings and residents so that, when you're doing your rotations or you're doing your ortho rotation in a few years, you'll be ahead of the game and know how to act. Showing then you can impress them. So academic components of the immersion program, you get to attend fraction pediatric conference, grand rounds, journal club. There'll be evening lectures. There'll be sort of additional workshops and resources, cadaver workshops. There'll be some social events afterwards, so you'll go through your day to day as a schedule, and then there'll be like social events afterwards with other students and maybe some of the residents and attendings. So here's a sample week schedule. So usually you'll have orientation on Sunday before your week starts. Now Monday you'll attend fracture conference and peds. This is also like varied by each person, just really depends on the resident's schedule. And so each person will get their own schedule, but this is just an example schedule that you might receive. You could shadow Dr. Cott and Brick. Then there'll be like a student dinner. Each person will have an operative day, probably two operative days, and 2 days in the clinic. There'll be a cadaver workshop, journal club, And then at the end of the week, you'll also submit your feedback, letting us know how it went and any improvements we can make. So this boot camp is usually reserved for M4s, and thus its immersion to the summer immersion program allows student interns to really get some hands-on training. Um, I know Dr. Cobb was saying earlier how this program is really important because a lot of students earlier on are interested in ortho, and it really is a good opportunity for you to go through boot camp early so you can really tell if it's for you, because you really do live the life of a resident during the week. So I think really it's really impressive that they be able to take care of this out, and it's really important that we keep on doing the best we can to make it bigger and better. So there'll be splinting, casting, suture, knot tying sessions. There'll be anatomy, prosection, dissection. You'll learn a lot about physical exams, comparing to limbs and spine, and there'll be lecture series recorded on Zoom as well. And so here's just an example of something that you might be doing when you're part of the summer immersion program. So there you see Dr. Cott working with one of our students last year, doing a anatomy dissection. So I think just getting that sort of experience with Dr. Cott really early on in your training would be really useful. And then, sorry, here's another video of what students were able to do last year. So I know a few of us did the tibial nail VR simulation. This is basically just like that, but with actual resources. And so exciting stuff here. So here's some of the feedback we got from previous interns who did this program. Students report exposure to new surgical techniques and clinic orthopedic exam maneuvers. I know a few of you might have attended the M1 or M2 summer panel last week or 2 weeks ago when they talked about what they did for their summers after their M1 year. And a few of them, I think Linda was a part of this program. She talked about how she really learned a lot from this program in terms of new surgical techniques, learning the physical exam. There's a high degree of satisfaction report for both the OR and clinical opportunities. I think you really get experience with meeting the residents and sort of building relationships with them, because that'll go a long way when you're actually on your ortho rotation here in a few years. And interns report that the journal clubs were helpful to improve their abilities to correctly praise the journal articles and connect with faculties in these sessions. So it'll be very useful for you to be a part of these journal clubs so that next year or you're even like in 2 years when you're going to grand rounds or you're seeing the residents present their research or their attendings, you'll be able to really understand their article and maybe future articles that they could further research. So this is an important slide. Applications will be due by February 23rd by midnight. So that'll be after our exam for coming up, and then that'll be the week of PDP that Friday. So by that Friday of PDP week, we'll have this have the application be due. And then applicants will be informed by March 1st if they're selected. And then applicants must submit a one-page statement of interest, a CV, and a letter of good standing from the registrar. And that letters are easy to get. You just have to email Jamar from registrar. And then you can submit all your application materials to OSIG, Summer Immersion Program at gmail.com. Please do that by February 23rd. If you guys have any questions, we actually have a former intern from last year with us today. That's Evan. So feel free to ask Evan any questions, or if you have any questions with the program in general, you can also ask me on Rude right now. Um, so yeah.
Before people ask questions, I'm just going to put the attendance tracker in the chat so people can fill it out while we're waiting on questions.
Sure. Awesome.
Evan, do you want to introduce yourself?
Hey everyone, my name's Evan, second year medical student. I did the summer immersion program last year. I was part of the first cohort. Um, I highly recommend it. I had a really good time. Um, it's as close as you'll be able to get to seeing what it's like to be a resident, um, especially this early on. I know you guys touched on it earlier, like that's a big part of it. It's shadowing and doing like the surgical shadowing is great and gives you some good experience to see what it's like. But this is the closest you're going to get to being a resident or living the life of a resident. And for me, I chose to do it because I wanted to see what that was like. Like I didn't want to wait until third year, middle of your third year, you get to do an ortho elective and you're there for 2 weeks, 4 weeks, however long you end up doing it, and you're like, this is like just miserable. And then, then you have to pivot midway through your third year. Um, so I really recommend it just to get a good idea of what it's like and to see is this something that you could see yourself doing for 5+ years of residency and then, obviously practicing. So I highly recommend it. It's just a week. The residents are awesome. They're all super, super friendly and they want to teach, right? They're not they're super kind and yeah, I highly recommend it.
Awesome. So we have a question from Kira. She says, what was your interest level in ortho going into the program? And would you say it was truly impactful in deciding to go down and to continue pursuing ortho?
I've been pretty committed on ortho since I even applied to med school. Before this, I was an athletic trainer. Then I worked in private orthopedics for like 2.5, 3 years. So I was pretty set on orthopedics. Um, I think the biggest impact that this had on me was really that like I said, like I did the entire week and I was like, this is something I could see myself doing for 5 years. Like I wouldn't be miserable doing this. Like obviously it's long hours and it's tough. One thing that I did that wasn't exactly offered, but like I highly recommend trying to go and do this is staying a night on call. Because obviously that's like the worst part of residency is having to do call. So that was really the biggest thing that had that I did it, stayed, did a night on call and I was like, it's tough, you're tired, but it's something that I really enjoyed. And as long as you're really truly interested in the profession of orthopedics, like you're gonna enjoy it. So I highly recommend it.
Yeah, that's awesome to hear. And one question I have, Evan, is do you think you're able to build an effective relationship with some of the residents and attendings that did not already have before, like going into the program? Like I know many of us already know Dr. Kotz, so maybe that's not like someone that you maybe met through the program, but were you able to build relationships with other attendings or residents through the program?
Yeah, I think that's definitely another huge part of it. Um, the one day I was with the one of the interns, so the way the residents have it up is one of the interns will be on pager. So basically like any consult that comes in, they'll be the first one to go see it. So I worked with Mike and he was awesome. I think we had a similar path to med school. I think we're both a little bit older, and we kind of formed a relationship there, and so that was a really good way for me to kind of get to meet one of the residents, build a relationship, and have a resource to go to now. Yeah, so I definitely think it's another opportunity there is to really resource or network with the residents, and like I said, they're all super friendly. They want to teach, they want to help us because they've all been in our shoes. So definitely a benefit of being in the program as well.
Great to hear.
Hey Evan, I got a question for you. Thanks for taking the time to speak with us. Could you speak a little bit about like the different types of cases that you were able to see in the OR? Was it peds, joints, or sports, or were you kind of limited to one specific department?
Give you a little bit of everything. The schedule can be a little bit hectic, right? Like you'll get a schedule at the beginning of the week, but obviously attending schedules change, resident schedules change, surgeries get moved here and there. So like one day I was scheduled to be with can't remember one of the spine surgeons. And then we ended up having someone who wasn't with Dr. McPartland who does peds.
Mhm.
So I got switched over to peds, got to do I forget what exactly was going on, but basically the patient had like a bunch of little bony growths in a few different places. So we got to remove them and I ended up getting to be first assist and I actually was taken out most of them. Like he just never met the guy, and he's just like, here you go ahead and do it. So that was a really cool experience. And then another day I worked with one of the hand surgeons. So I think there'll definitely be an opportunity to do probably like 2 or 3 different things throughout surgery, and then obviously you'll get to be in clinic. So yeah, you'll pretty much see all different aspects from trauma, peds, sports, the works.
Thank you.
Mhm.
Thanks for coming on, Evan. Quick question for you. I know that the M2s like hadn't had any anatomy before the program last year. Can you talk a little about like what you did to prepare for this summer program in terms of like going into the OR, not having like that background, and for M1s who have taken anatomy like months and months before, like how we can kind of stay fresh?
Yeah. This is a little might be a better question for Anirudh. No. But like for me, like I said, I was an athletic trainer for a few years. That was my undergrad, did that for a few years, worked in orthopedics. So like coming into med school, like that was really my foundation. Like I was just really good with anatomy. Like I didn't have to study much during anatomy, but I learned so much of it from school and from profession. So for me, I didn't really do as much. I don't know if Anirudh has a comment on his experience with that.
Similarly to Evan, I don't have any experience as an athletic trainer, but just my experience with like athletics, just growing up and being a powerlifter in undergrad I had some anatomy knowledge. However, the thing is that knowledge is going to be kind of built upon when you're in the program because you see a lot of things that's specific to the orthopedic realm that aren't explored in anatomy. Because yeah, like in our anatomy course, we do explore a lot like the basic structure function relationships, but you'll see like in the anatomy session, like Dr. Cott was actually walking through like compartments, and that was something that was like novel to me. So I didn't know that like those were things that we had to pay attention to. But like being there is you get the opportunity to learn. So I don't think you have to prepare for anything because you're not being quizzed. And the idea is that you're there to actually learn and see things for the first time. And everyone has that expectation of you, like that you're there as an M2. They know that you're an M2. So you're not going to get quizzed or pimped or anything like that. But just it goes further than that. There's like you can review a little bit, and I think that's helpful for just maintaining what you've learned, obviously, right? But don't feel like there's any pressure to be like super up to date with everything, because the whole point is for them to teach you.
Yeah, I think that's perfect. Like if you know stuff, great. If you don't worry about it. Like they're not going to be like they're not going to fault you for that. You're not going to get looked down on. They're not going to, you know, knock you for that. So um just try to do your best to come prepared, right? Like I would just say like like if you're gonna be with a hand surgeon the next day, like just the day before, like look over a little bit of hand anatomy, like stuff like that. Like just try to prepare yourself for the upcoming day the best you can. But like if you don't know stuff, like don't sweat it. They're not grading us, they're not judging us. They know that we're there to learn and kind of see what it's like. So it's super laid back and super relaxed.
Evan, I got a question. What was your favorite sort of like workshop or lecture or sort of a like journal club, or like was there any part of the program that you could like pinpoint as your favorite?
Tough question. I really do like the workshops. You get to do a lot of stuff on the practice equipment, whatever you want to call it. The stuff that they bring in to do it. You guys said you did a workshop, right? Like with the nail. We
Mhm.
did joints both times. Like the stuff they bring in is pretty realistic, and um, it's just really fun to get to actually do some of the stuff that you hope you'll be doing in a few years. Um, yeah, I'd probably say the workshops just because I like actually doing things like getting hands on and doing stuff like that. So.
Great, thank you. Anyone else have any questions? All right, I think that should do it. We'll have the summer immersion email. I think I'll go back to that page. This is the email. I'll send the slides to all of you guys and to everyone on the OSIG like chain on the email chain. So I'll have access to that. And if you have any questions, you can reach out to me directly. Um, and just let me know if anything. But other than that, and we'll also I know there's a question in the chat about the dates. And I saw Ryan respond to that. So it's anticipated it's gonna be the last 2 weeks of June, but once we hear back from Jomar, we'll let you guys know before applications are due. So you'll be on the lookout for that. But other than that, I think
Hey, Dan, I got one more question for you.
sure.
So I know a lot of us are looking at a lot of different things to apply to because there's certainly no guarantee that you get any research program or get into the immersion program. Is the application binding?
No, I don't. It's not binding. If you get accepted and then you are not able to make it, then that's you could politely decline the application, and that's fine.
Awesome. Thank you.
So yeah, I think if no one has any other questions, then we could hear back from you guys at the end of February. So thank you guys for joining today.